Lyme disease and COVID-19 can have similar symptoms, but there's some important things that distinguish them as well. The similarities include presenting with symptoms that we sometimes call flu-like symptoms, which are fever, chills, generalized muscle aches and pains. Those flu-like symptoms are actually common to both COVID and Lyme disease. What's different is COVID is a respiratory infection. So COVID almost always, in addition to those flu-like symptoms, will have cough, shortness of breath, sore throat, things that are typical respiratory symptoms. Those respiratory symptoms are not typically part of Lyme disease. Some particular symptoms are found in COVID that are unique to COVID when we compare it to Lyme disease. One very specific symptom is the loss of taste and smell, which is peculiar to COVID and doesn't occur with any regularity in Lyme disease. The other feature of COVID can be diarrhea in some cases, and again, diarrhea is not a typical manifestation of Lyme disease. A common symptom in Lyme disease that is unique to Lyme disease and not present that often in COVID is neck pain and joint pain. Lyme disease has a predisposition for causing joint inflammation and pain, and that's not typically part of COVID. The other very important difference are the rash or skin manifestations. It's well known that Lyme disease has a predilection for causing a round skin lesion that's red and sometimes takes the appearance of a target lesion that is almost always large, red, and round, typically more than 2 to 3 inches in size. This red lesion occurs at the site of the tick bite where the infection is initiated and is really highly suggestive of Lyme disease. These types of rashes are not seen in COVID.